So, you're watching this, and my guess is you're dealing with some really confusing, maybe even scary symptoms. Things like neck pain, arm numbness, or tingling fingers. Well, you are in the right place. The whole point of this explainer is to give you clarity, not to cause panic. So, let's jump right in.
You know, this quote from our source material just absolutely nails it. It's so easy to get the signals from our body wrong. We think, oh, it's just stress, or I must have a tight muscle. But a lot of the time, the real issue is this misunderstood nerve path. We're going to follow that electric line together and figure out what's really going on.
All right, first things first, let's break down that big, kind of scary medical term, cervical radiculopathy. It sounds super complicated, right? But the source puts it in the best way possible. It's just a fancy name for when your neck gets bossy and your arm is the one that pays the price. Think of it like your neck is the boss and your arm is getting all the angry emails.
Okay, so how does this whole thing manage to trick us? Well, the crazy part is the pain isn't always where you'd think. It might show up in your shoulder or that annoying spot between your shoulder blades, sending you on a total wild goose chase trying to fix the wrong thing. Let's look at why these messages from our neck are so sneaky.
And this right here, this is the big one. This is such a crucial point. If you have pain, tingling, or numbness that travels, that's a whole different ballgame than a simple muscle ache. As soon as your sensation or your strength starts changing along a specific path, your body is basically screaming, hey, investigate the nerve, not just the muscle.
So, how do you investigate? Well, you've got to become a bit of a detective for your own body. This section is all about learning to see the patterns in what you're feeling. Our motto here is pattern over panic. Let's walk through the 7 most common signs, step by step.
The first 3 signs are all about how it feels and where it goes. So, for number 1, a consistent line of tingling that always goes to, say, your thumb and index finger, that's a classic clue. For number 2, we're talking about a sharp, zappy, almost electric feeling, totally different from a dull muscle ache. And then there's the classic decoy, thinking you've hurt your shoulder when really the problem is starting all the way back in your neck.
Next up, weakness. And listen, this isn't just, oh, I'm tired from the gym weakness. No, this is different. It's when you notice you're struggling with simple things like opening a jar. Even if it's just a little bit weaker, that's a really meaningful signal. And number 5? Oh, this one is a huge clue. If looking down at your phone for a few minutes reliably brings on that tingling, well, that direct link between your neck position and your arm symptoms is something you absolutely have to pay attention to.
And these last 2? Man, are they easy to just brush off. Waking up with numb fingers? I just slept on it wrong. That nagging pain between the shoulder blades? It's just my posture from sitting at a desk all day. But when you see these things show up together with those radiating arm symptoms, it paints a much, much clearer picture of what's really happening. So, if you take one thing away from this whole section, let it be this. It's not about how much it hurts. It's all about the pattern. The specific path the symptoms travel, what makes them better or worse, and which fingers are involved. That information is the most powerful tool you have.
All right, we've learned how to spot the patterns. Now, we need to have a serious but calm talk about safety. This next part isn't meant to scare you at all. It's about being smart and knowing when it's time to stop Googling symptoms and go get immediate medical advice.
So, that's the big question, right? Most of the time, these symptoms are manageable and not an emergency. But sometimes, they are. So how in the world do you know the difference?
Think of this as your stop everything and see a doctor today checklist. A yes to any of these means you need a same-day evaluation. Things like getting weaker really fast, sudden problems with your balance, or, and this is a big one, losing control of your bladder or bowels. These are all signs that something more serious could be going on. Please don't wait on these.
Okay, deep breath. We've covered the serious stuff. Now let's switch gears and talk about what you can do right now to empower yourself with a little more information. We're going to go through 3 super quick and gentle checks to gather more clues about your own body.
Let's walk through these together. And remember, the number 1 rule is to be gentle. We are not pushing through pain, we're just gathering clues. So keep any discomfort below a 3 out of 10. First, the posture reset. Just gently tuck your chin like you're making a double chin. Hold it. Does that change anything? Second, the relief sign. Take the hand of the arm that's bothering you and just rest it on top of your head. This often gives the nerves a little more room. And third, the screen time trigger. Just notice what happens after a few minutes of looking down at your phone.
So, what did you just find out?
Well, if your symptoms got better with one of those checks, that's fantastic. It's a huge clue that your symptoms are position sensitive, which means you have a direct way to find some relief. Now, if they got worse, don't panic. That's also a super useful clue. It just told you exactly what not to do for now. So stop that movement immediately and don't push it.
All right, you have way more information now than you did a few minutes ago. So, what do you do with it? This last part is all about action, a super simple first step for some immediate relief, and a clear guide for what to do next.
This little card is basically your roadmap. Let's look at the 2 lanes here. Are you in the conservative first lane? That's probably you if you don't have any worsening weakness and your symptoms get better with posture changes. But if you do have weakness, or the pain is really bad and just not letting up, then it's probably wise to get into the escalate sooner lane and go get a clinical evaluation. But forget about the next few days for a second. What can you do in the next 60 seconds? This. Seriously, right now. Find a chair with good back support, sit all the way back, and then grab a couple pillows and stick them under your forearms. Let your shoulders completely relax and drop. This simple little trick can give you some immediate, noticeable relief just by taking the load off your neck.
So we're going to end on this question. You came here probably feeling confused, maybe a little worried. But now you know the signs to look for, you know the red flags for safety, and you've even done a quick test to understand what's going on. You're not in the dark anymore. So the only real question left is, what are you going to do in the next 15 minutes to start on your path to relief?